I guess my perspective on things are also different, and when designers design a room, they are thinking about an aesthetically beautiful environment, and maybe they have other thought processes, I don't know. But mine, coming from the nursing process, is the first thing, the hospital is saying we need to all be involved in our own environments. And besides thinking about patient satisfaction, I was thinking about what I can do that goes beyond giving a pill for pain, and I guess infusing that kind of thing into the environment. So it started with our curtains were tattered and they were going to be replaced, and I wanted to go beyond just getting another clean white curtain to hang. So I researched color, because I know that the environment affects sometimes focus, and if you focus on things like pain, it intensifies the pain. Sometimes if you have something else to focus on, the pain doesn't go away, but it alleviates it. So if you focus on the pain, it intensifies the pain. If you focus on something else, like I said, the pain doesn't necessarily go away, but it alleviates it, and a lot of times that allows the medication to actually work. Sometimes anxiety actually adds to the focus, which adds to the intensity of the pain. So I was looking for something to distract the patient, but of course it needs to be calm, and so I researched color. And I know that imaging a lot of times helps with distracting patients. So, gee, I felt lucky. I just tripped over your website in this months of research, and I said, I looked at it the first time and I saw this photograph and I went, wow. If I was laying in a hospital, boy, I'd love to be able to look at that. And when I started looking through it, I wanted to be in there. There was a picture of an ocean, and I could feel the wind, and the color just soothing, and that's what I wanted to do. So I thought to myself, wouldn't my patients benefit from having that kind of imagery to be able to focus on and have an escape? So that's how I ended up choosing those curtains. I wanted to go beyond just a clean, sterile curtain and, some little prints on there. Like you said before, that I did buy one curtain at a time, because I, of course, have a budget to mind. And initially, I tried to explain to the staff, and they really didn't understand. They just wanted some new curtains. And I ran it by them and told them, the colors I was going to choose and the purpose. And, there was some nurses that said, oh, I don't even like blue. Blue? Why are you picking blue? I said, it's not about the blue in of itself. It's the effect that the blue has on people looking at it, and this image and all of that. I said, it's a combination of many things. So I bought the first curtain, despite, a few groans and moans. And the funny thing is that the people that said that they didn't like blue actually fell in love with the curtains, because they could then see beyond. It wasn't just a blue curtain that I was getting, it was the background that added to that image. So it looks, because of the image of outside, it just looks like a repeat of outside, the one I chose anyway. Where in Florida, you're locked up in a hospital, you don't get to see the palm trees and whatnot. It's just a reminder of what's outside, and sometimes people come, tourists come and end up in our hospital. It's just a nice thing for them to focus on and see. And between the change of the nurses on a daily basis, you can see them then start talking to the patients. We've even had patients that, some people are talkative, some people aren't, and we have patients who, the non-talkative ones, will not say anything, and all of a sudden there's a procedure that needs to be done, and you pull the curtain and they go, wow. Or you hear, oh, I love your curtains. and they are actually looking at it and not so much paying attention to everything that is actually being done, but they're looking at the curtains. It's that little distraction, like I said, so that the procedure isn't so scary, isn't so intensified. So it's interesting, the effect. Think of a single person. I just know the overall effect of the curtains is a change every time the curtains are pulled. In general, when the nurses pull them even, sometimes the environment just sort of becomes routine. It blends in on a daily basis, but when the nurses pull the curtains to do a procedure, you know, it affects them as well. It's just, I've heard comments about how calm that they will feel, and they help the patients then become more calm. It's kind of like a snowball effect. It's really wonderful, and they don't realize even that it's happening. It just, you know, it just goes with the, you know, environment. And it's really exciting.